Hello everyone, this is Dr. Anjali Kumar, once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. But today we will be talking about something which concerns everyone's health. Today everyone is scared with the thought of getting a COVID-19 infection and scared worse about the kind of treatment which might or might not be available. So what to do if you are found to be COVID-19 positive? We will be talking about the steps of treatment, home treatment, hospital admission and more. So we all know the symptoms of COVID-19, which is fever, throat pain, dry cough, maybe a running nose, body ache, malaise, loss of taste and smell. But this new mutant virus is also showing some unusual symptoms like abdominal pain, nausea, vomiting, diarrhea, skin rash, headache. So now you get the RT-PCR done and it is positive. So what is to be done now? Number one, do not panic. Remember, in 80% of the cases, the disease is likely to be mild and it will not require any special treatment or hospital admission. Now start with an online appointment with a doctor. Remember, most of the cases can be managed by a home treatment protocol. So what does the home treatment protocol involve? Number one is the medical treatment and monitoring. Second is the isolation of the patient. So let's first start with the home medical treatment and monitoring. You need to first arrange few things. You need to arrange a thermometer. It could be a simple thermometer or maybe an infrared thermometer, pulse oximeter, a blood pressure apparatus, gloves and masks. You need to be monitoring the pulse, blood pressure, temperature, and the oxygen saturation every 8 hourly. Record it on a paper or maybe an Excel sheet and inform your doctor daily. I want to talk about this pulse oximeter in little more detail. Now it's a small device which is used to measure the oxygen saturation of the blood. It is commonly available. You can order it online also. So there are a few things which have to be taken care of before you measure the oxygen saturation. Number one, rest for about 5 minutes before you measure your oxygen saturation. Remove any nail polish or maybe any false nails in case you are wearing. Make sure that you warm your hands nicely. After that, you switch on the pulse oximeter. Press it here and now you place your either index finger or the middle finger in this groove. Wait for some time and once the reading stabilizes here, then you take the reading. Ideally, the oxygen saturation should be more than 94%. In case the oxygen saturation is between 92 to 94%, you need to be monitoring it more frequently, maybe even hourly. In case the oxygen saturation drops to less than 94%, immediately inform your doctor. These days we also advise a test which is known as a 6 minutes walk test. So in this basically we want to know if there is any drop in the oxygen saturation after an exercise. So for this you need to be measuring your oxygen saturation first, then walk for about 6 minutes on an even surface without a pause. And then once again measure your oxygen saturation. In a normal healthy person, there should not be a drop of more than 3 to 4% in the oxygen saturation after this 6 minutes walk test. In case the drop in oxygen saturation is more, once again inform your doctor. You need to be drinking 2 to 3 liters of warm liquids every day. Maintain good hydration. Do warm saline gargles or maybe betadine gargles. Now this would soothe your throat and also reduce the viral load in the throat. In case you have a lot of dry cough, you can use any of the lozenges. You can take strepsils, Honitus, Alex, whatever soothes your throat. Take vitamin C 500 milligram twice a day. You can also take a zinc tablet once a day. Take tablet paracetamol 500 milligram to 1 gram 6 to 8 hourly. You could either take crocin, calpol, dolo, they're all one and the same. You just need to be keeping temperature under control. Antibiotics are usually not needed. Remember, COVID-19 is a viral disease. You don't need an antibiotic. You may take an antiviral drug called ivermectin, but only after the advice from your doctor. Steroids may be added. Tablet dexamethasone, which is about 4 to 8 milligram once a day, or tablet prednisolone, which is about 8 to 16 milligram twice a day, once again only after the prescription from the doctor. If you are taking the steroid, the doctor also might add an antacid, which is like a PAN 40 to it. Make sure that you walk at least 10 minutes twice a day in your room. Even while resting, make sure that you're doing some active limb movements. This prevents thromboembolism. It's very, very important to be doing breathing exercises. Now, by doing that, you actually keep your lungs very elastic. So you can do, number one, diaphragmatic breathing. It is simply a deep breathing exercise. So you inhale, and when you inhale, expand your abdomen, and when you exhale, make sure that your abdomen tucks in completely. You can also do what is known as a humming breath, or it is also known as Brahmari. So you inhale deeply, expand your abdomen, and when you exhale, make a humming sound. In both these breathing exercises, make sure that the exhalation is longer than the inhalation. If you have a spirometer at home, please do spirometry exercises. You can also do a balloon exercise, which means simply take a balloon, try and inflate that balloon. All these exercises help to keep the lung elasticity in place. Then let's talk about a specific medical practice which is known to improve the oxygenation in the body. This is called proning. So in this, the person lies on the abdomen. So how proning helps is, number one, it helps to open up the alveoli and it helps to drain the fluid from the alveoli. So for this, you need about 4 to 5 pillows. One pillow needs to be kept under the neck. 2 pillows need to be kept under the abdomen going up to the thighs, and 2 pillows need to be kept under the shin. Lie down for about 30 minutes in the prone position, then maybe 30 minutes on the right hand side, 30 minutes then on the left hand side, 30 minutes again on the prone position, and then you can sit up for about 30 minutes. You can repeat this cycle many times during the day. Take a simple, healthy, homemade diet with less spices, like simple rice, dal, roti, sabji, lots of fruits and vegetables. Try and include things like turmeric, ginger and giloy. These are natural immune boosting antioxidants which you can include in your diet. As far as the blood tests are concerned, please do them only when advised by your doctor. Please do not get the blood test done on your own. Remember, the medical system at present is already overburdened. The next most important part of the home management care is the isolation of the patient. A COVID-19 patient should be kept in a separate, well-ventilated room which has an attached toilet and a 24/7 availability of a caregiver who is also healthy. So make sure that you are always in your room. You're not moving around in the whole house. Don't share your personal things with anyone else in the house, like your clothes, towels, utensils. Make sure that you're wearing a double mask always. Change your mask every 8 hourly, or if it gets soiled before that. And then the mask should be disposed after treating it with 1% sodium hypochlorite. The cleaning of the patient room can be done with a regular detergent followed by mopping with 1% sodium hypochlorite. The table, the cupboards and the knobs also can be cleaned with the 1% sodium hypochlorite. As far as washing of the patient's clothes is concerned, they should be washed separately in a separate washing machine at 60 to 90 degrees Celsius using a regular detergent and then drying them in a normal sun. Now let's talk about the warning signs, which means now this patient cannot be managed at home and now this patient needs to be shifted to the hospital ASAP. Number 1. If the temperature is more than 101 for last 3 days. In case the pulse is more than 110 per minute. In case the systolic blood pressure, which is the upper blood pressure, is less than 80 millimeters of mercury. If the oxygen saturation is less than 94% at room air. In case the person is not passing urine or is passing very dark colored urine. In case she is having a lot of chest tightness or breathlessness, and even if the SpO2 is normal. Or if she is having mental confusion, dizziness and giddiness. I know now this could be difficult. Arranging a hospital bed today is a nightmare. So please keep talking to your doctor, be in constant touch with your doctor. Meanwhile, keep following the government portals on the live status updates on the bed status. Meanwhile, make sure that the patient is in a prone position. If you have an access to the oxygen cylinder and the nasal cannula, you can start the oxygen at 2 or 4 or 6 liters per minute, trying to maintain the oxygen saturation at 92%. I know the situation is very difficult, very grim. Like all of you, I also hope that the situation passes soon. Till then, please keep taking all the COVID protocols very seriously. We are starting the universal vaccination on 1st May. So please take the vaccine and please convince everyone around you to take the vaccine. And once again, today, if you found this information useful, please spread this information with your friends and family. And do not forget to like, share and subscribe Maitri, and I will see you soon.